Hello everyone, I'm Dr. Anita, aesthetic and plastic surgeon. Today, let's discuss about the most hyped topic, that is liposuction. So, what is liposuction? Basically, lipo and suction is the word. Lipo means fat and suction means suctioning it out. So basically, taking away the fat from your body is liposuction. Who is an ideal candidate is not the question. Who is not an ideal candidate is the actual question when it comes to liposuction. You have heard these people most number of times. I will eat and finally I have one solution. I'll go get a liposuction done. Definitely, you're not a candidate at all for liposuction. So who is an ideal candidate for liposuction? A person who's determined, lost weight, gone on diet, and then gone on exercise, and then he has a nice skin tone, he's maintained a stable weight, and then here he is with some areas of fat here and there which is not responding to any of those above methods. Then yeah, you are an ideal candidate for liposuction. So why not the above category? The above category, you look at them, basically when you actually are telling that you're going to eat and then liposuction is your answer, definitely you have to remember this. There are two types of fat. One is the visceral fat and the other one is the peripheral fat. Always, liposuction addresses only the peripheral fat. Then what about the visceral fat? This is the fat which is accumulated around your organs. Like you have heard of fatty liver and all that. So basically it's around your internal organs which will not be touched by liposuction. So now even though you do a liposuction, that part of the skin, that part of your fat is not going to be addressed, and yes, you're still going to look fat if that is not touched. So ideally you have to have that stable weight and should have tried other measures, but then it's not responding, then yes, definitely you are a candidate. So why is that skin tone important? Just imagine that you've already been having that saggy skin, and then you think that liposuction is going to do all the trick. No, definitely not. Yes, there will be some amount of skin redraping and skin contracting and stuff, but definitely it's not going to be to that extent that the whole lax skin is going to come and attach back to your body. So you have other techniques like there are different types of plasty like abdominoplasty, thigh plasty, arm plasty, stuff like that. So these are the things which you have to remember. Now that we've spoken about different plasties and everything, so which are the actual areas which we do common liposuctioned areas? That is what we'll discuss about. So mostly the areas which is usually which people actually come for liposuction is the back, the upper and the lower back, the flanks, the chest area, the abdominal area, the arm area, the thigh, many people do come, calf, and sometimes the ankle as well. So what is these etching, liposculpturing and all of this? There are so many people, and now that COVID has come, everybody wants to have that sculpted body and everything. They have gone on like these gymmed, everything, got themselves well equipped and everything, but still they don't have those six packs, two packs, or a defined pectoralis or a defined deltoid. Then those are the candidates who actually want them to be defined, but then it's not defined. Yes, liposuction does have a role in this. We do give proper definition. It's called liposculpturing, etching and stuff. So through liposuction we can definitely get these stuff, but remember, all of this is good provided you have also done your homework. Your part of the story comes first, then comes the doctor's story. Is liposuction a very big surgery? It depends on how much of fat we are aspirating. So anything more than 5 liters, we just tend to be a bit cautious because there might be a few minor changes in the body responding. So we might keep you in if we have we might keep you inside the hospital if we have aspirated something more than 5 liters. Otherwise, definitely lesser than 5 liters, you're good to go. In and out, one this side, one that side. We tend to see you, observe you and stuff. and what all are the things which you have to keep in mind before you come to surgery. If you are smoking, it's better you actually quit smoking at least 3 weeks. You're on any herb, any medication, homeopathy or anything, we generally tell you to stop that. These are the things which might which might increase the chances of you bleeding. We don't want you to post a cosmetic surgery, we don't want to have any complications, so we usually tell you to do this. Even alcohol and your weed, everything, it's ideal that you stop all of these for 3 weeks, not on any medication other than your thyroid or BP medications. Others, it's better if you can stop it, definitely it's better you stop it. As I've told you, most of it is a daycare surgery, and barring a few. So what are the things which you keep in mind when you come for liposuction? So there is definitely going to be some amount of pain. It is not like your plasties where we cut and definitely the pain is way lesser, but you do have some pain, and most of it is most of it is taken care by painkillers. The next thing is bruising. Bruising is something where any like at any place post your surgery can happen, so that will definitely go away, keep this in mind. And the next thing is collection, fluid collection happens mainly because you have that fat which was between your organs and your skin, and we've taken out that fat cell. Now the skin has to redrape. Before the skin redrapes, the body also does produce some reactions, because of which some fluid will be collected. Most of the time we can manage it very easily. That is why we give this pressure garment. So what is this pressure garment? Pressure garment is something which will, whichever area have undergone a liposuction, in that particular area we will be giving you something like a tight garment. So this garment will stay with you for at least 1 to 2 months. We'll based on your progress, we can taper it early or we can prolong it for at least 2 months. So this pressure garment, you are supposed to use it up to 24/7, and this kind of helps the water collection, which I told you to be relatively on the lesser side. So now that you've undergone liposuction, can you now eat, and can you now freak out with those cheat days being more higher? Definitely not. It's like, always remember, as I said, there is the amount of fat cells in your body is stable. So even though we have taken out that amount of fat cells, there will be remaining fat cells. Without fat, like, you cannot aspirate the whole amount of fat, so those fat cells which is there tend to hypertrophy. So remember, after liposuction, it is ideal for you to have a stable and healthy diet so that you don't gain weight. Definitely you will be motivated, you will be able to do a lot better, but remember, always remember that you have to definitely maintain this weight. You have to maintain this weight. The diet and the exercise goes hand in hand. It's only it's just an addition to your weight loss, but it is not the weight loss. As I said, weight loss or getting into shape is definitely by diet, exercise. This will only, it's just not a substitute, it's just an addition. So it just helps you to get back that shape, but you have to maintain this. So are you like photo ready the next day? As I said, it's definitely not. Photo ready does come, at least give it some 3 months, because there'll be a bit of bruising, there'll be a bit of edema, like as I told you, there'll be skin edema also. That all of it will take edema, swelling, so all of it does take time to settle. And by around 3 months, definitely yes, you can expose that area whichever you've undergone liposuction. And coming to something which everybody has this hype, so the scars. Yes, there is scars, but the scars are brilliantly hidden, or hidden in areas where people generally don't tend to notice. So we will always look at areas where it is which will be under your panties or your braziers, something like that. So even if you wear it, even if you wear it, you will definitely not be able to see the scar. The scar, even if it's seen, it's just 5 mm. It's something like a small scratch. Nobody is even going to notice it, and it can be easily camouflaged by your small makeups also. With this, I come to the footnote which you have to remember. Liposuction is just an addition for your weight loss program where you are not, where it's just for that stubborn fat. Always, always, always remember that there is no substitute for diet, exercise. Remember, you have to carry on the healthy diet and exercise post your surgery as well. Thank you.